Hi friends, I welcome Dr. Kanmani Murugesan, who has scored rank 1 in NEETSS Gynaec Oncosurgery, who is going to share about her achievement and how her preparation helps in cracking the NEETSS 2021 Gynaec Oncosurgery. Because not many coachings are there, content is not properly channelized, but in spite of all those struggles, even concept is not complete content for NEET as a Gynaec Oncosurgery. So in spite of all these struggles, she has got rank 1, which is one of the dream seat for gynecology is going to become a Gynaec Oncosurgeon. Welcome, Dr. Kanmani. Please introduce about yourself, doctor.
Thank you so much, sir. So I'm from Tanjavur, sir. I did my UG in Madras Medical College and PG from JIPMA. I'm currently working as a senior resident in PSG Hospital, sir.
Coimbatore.
Yes, sir.
Yeah, a good doctor. Because many dream about Gynaec Oncosurgery. Many physician also wants to do that because increasing, especially in Tamil Nadu, I can say increasing number of physician. One of the reason, and the second reason is physician who wants to practice gynecology and cold gynecology rather than obstetrics, or choosing either infertility or practicing oncosurgical side, that is Gynaec Oncosurgical side, which is one of the leading malignancy in India. Have you prepared that, doctor? Because whoever is listening, it will be useful for them.
Sure, sir. The thing is, OG is not an end specialty. There are so many super specialization, subspecializations in OG right now. We have fetal medicine, maternal medicine, urogynecology, gynae oncology, gynae endoscopy. So many subspecializations are there. Uh, Basically, I chose gynae onco. My favorites are gynae onco and maternal medicine. They are two different things. One is completely medicine related, and the other is surgery related. But that's how OG is. We have to be prepared in both aspects. I have been. I started giving NEET in 2020. I graduated in 2019. I started giving NEET in 2020. So that NEET was without much preparation. But I came to understand what is the pattern of question that is asked, how to prepare. So for understanding all those, NEET SS 2020 was the platform for me, sir. The change in pattern happened for OG. The gynae onco in 2020 itself. So what happened is, just 1 month before the exam, we came to know that even if we are opting to write gynae onco, it's a clubbed specialty of gynae onco and reproductive medicine. So that was a shock for all the aspirants who came to know just 1 month before the examination. So all of a sudden, who have all been preparing gynae onco, we have to start preparing for reproductive medicine also. So it was quite difficult that 1 month time. But when appearing in NEET SS 2020, I came to know it's about the basics, sir. Previously I have heard that we have to go for all the bigger books, that's the MCH books, for even preparing for the entrance examination. But when I sat for the 2020 exam, I came to know it's all the basics. Even if it's gynae onco or reproductive medicine, it's all the basics. So what I did from 2020 to 2021 NEET is that I wanted to strengthen my basics of OG. So I didn't go for any big books, sir. So I limited myself to Williams Obstetrics and Novak's Gynecology, which are like the basic books that we read in the PG period. So I read it in and out. So I would be able to answer if something is asked even in between the lines. So that much how it was also easy to read the same books that I read in the post graduation also, sir. So when I read those basic books, I was as you know, sir, 40% of the question is going to be from the general specialty and the 60 is going to be the subspecialty.
True.
So I was confident that this 40 I would be able to crack. For the aspirants, I would like to tell them that we can't take this 40% general very lightly. It's not like without much preparation we would be able to answer those 40% of the questions. It's going to be very twisty. Those 40% of general questions are going to be very twisty, rather difficult to answer than the specialty itself with preparation. So this 40% I think we will be able to crack if we read the basic books. That's Williams and Novak's. Now coming to the specialty part, that is two specialties. One is Gynaec Onco and reproductive medicine. Gynaec Onco, being from JIPMER, I had a strong base, sir, because we were dealing with so many gynae. We had so many exposure to gynae onco cases there. So on that base, I tried to build up with all the FIGO cancer reports, whatever I could get my hands on. I used to build my knowledge on the gynae onco part. So that's where concept comes into action, sir. So I came to know about concepts question bank just some 1 month or 2 months before NEET 2021, sir. So I subscribed to it. So when I opened the question bank, I could see the standard of questions there. That standard of question, it's actually superb, sir. So it was like the questions were designed as if they ask from even a minute aspect of one cancer, I will be able to answer. That's how it was designed, from the basics to the trials. Everything has been concise in one module of each cancer, sir. So I used I will read all the cancers, then I will go back to the module wise questions in concept. So once I solve those questions, I will be confident that yes, I have covered this particular cancer. I will be able to answer if it's asked in the exam. So that's how I prepared for the Gynaec Onco part, sir. Reproductive medicine, again, yes, it's going to be the basics, which if we read the basic books, we will be able to understand. And I had subscribed to the question banks, other question banks also. So those question banks also helped me, sir.
True, doctor. Now, this one, like NEETSS 2021, the last minute changes, all those things has happened. But one thing, the student whoever has cracked the seat is like stick to the basic. That's how you also have done. Stick to the basic. The 40 questions, the 40 has helped those who have stick to the basics rather than going jump to the higher book and forgetting those contents instead of finding a time to revise. So whoever has read the basic and revised the basic again and again has cracked the seat in all aspects. That's how neurosurgery aspirants, urology aspirants, oncosurgery aspirants, everyone gives the same kind of feedback. And one thing which I want to convey is like also want to get an input from you is, as you said, this NEETSS 2021, yes, of course, Gynaec Oncosurgery plus reproductive medicine, and it is same since 2019, and 2022 it is going to be a change. So almost 30 subjects, 30 subject specialist specialty based exam is going to happen. If suppose that also not very crystal clear, NMC based upon the Supreme Court verdict, like NEETSS 2021 is like NEETSS 2020. But whether are they going to change the NEETSS 2022 pattern, or are they going to change stick on to the NEETSS 2021 is $1 million question. Okay, but if suppose you have given a good guidance how to go ahead for NEET, if pattern is like a NEETSS 2021, but there's a pattern like OBG group. They are dividing surgery group, ENT group, ortho group, OBG group. It's like entire finalized subjects and the entire specialty is being designed as individual groups. So in such case, if it is a OBG group, out of that 150 questions from the OBG will be asked, how a resident has to prepare for OBG group, because basically they will be eligible for Gynaec Oncosurgery. All those things they have given in the last prospectus, which was cancelled by the Supreme Court verdict. So please tell how a OBG group students, if suppose, because if a OBG group student, if suppose they stick to the NEETSS 2021, It is going to useful for part A questions. That is a 40 questions. They have to be very strong in that. Please guide in that aspect also, doctor.
Sir, when we, when the pattern change was proposed this year, sir, for NEET 2021, I think it would have been difficult for other specialties, but for OBG group, what was in the 2020 pattern only was proposed for 2021 also, sir. The pattern change, no, sir. What they proposed is the OBG group. I don't know about other specializations, sir. The OBG group, what we were supposed to do in that new pattern is that we have to be prepared for both reproductive medicine and gynec oncology. These are the two subspecialties that are available for OBG people in MCH. So the new pattern which proposes an OBG group, it's going to have, it's the same as 2020, sir. We have to prepare for both reproductive medicine and gynec oncology. So the other specialty peoples will find a drastic change in the pattern of their preparation, sir. But for OBG people, it's going to be the same, sir. What is proposed in 2020, no, sir. What we have been writing in NEET 2020 and 2021 is the proposed new change that's going to happen in 2022, sir. I don't know how's the pattern of questions is going to be, whether it is 40, 60, or what's the proportion. I'm not really clear about 2022, but the specialities that we are going to prepare for, we have been preparing for both specialities from 2020, sir. So it's the same. So how the preparation is going to be is what we have been discussing so far, sir. That's stick to the basics and solve as many questions as possible. As many That's going to sharpen your knowledge. The solving questions thing, that's going to sharpen. For example, sir, there are negative question, two negative aspects happening in a question which we will be in. If we are in a stressful environment like we sit in an exam, it's going to be difficult for you to see that aspect of question when you are sitting in the exam. But if you keep on solving those in question banks, and then it will be easy for you if you sit in the exam. Regarding the preparation part, I think every other coaching institute are going to change their coaching pattern if the new 2022 pattern comes. So I think guidance from someone is actually going to help.
Yeah, true, doctor. Even there are a lot of inquiries for gynec oncosurgery after you get the seat, and that was proposed in the Facebook and social media. Many have messaged like they want a program for gynec oncosurgery. Now I have got a clear idea. Then one more thing, like in reproductive medicine, how you prepare, doctor? What was the reference book for you, so that let them also benefited?
Yes, sir. So basic again is Novak's, sir. Berek and Novak's gynecology. There is a book chapter. The big chapter on reproductive endocrinology. So that has to be covered. So that is the base on which we have to keep on adding. So the other books that I referred is Kamini Rao's book is there, sir, for infertility. So that book is a very actually easy read. So it's like reading an MCQ book only. So that book also will be very helpful. And the ART aspect, there is a big book called Gardner, sir, but it's I think it will be difficult to read a new book all of a sudden for I think some 5-6 questions to crack. But people are coming up with the notes for all those big books. I think that will be helpful too.
Yeah, like how many questions they asked in out of 60 questions reproductive medicine? How many questions they asked? How many questions they asked in oncosurgery, madam? Gynec oncosurgery.
Sir, to tell you frankly, I was actually finding it the gynec onco part, sir. Maybe I was preparing for it for a long time. So I found the gynec onco questions to be very basic in the exam. Among the 100 questions, the gynec onco part seemed very easy to crack. But our preparation regarding reproductive medicine was very limited, sir. My preparation for reproductive medicine. So I found that aspect to be difficult. Maybe because of that, among the 100 questions, I found the majority even in the general 40% of the questions, sir, majority was addressed towards reproductive medicine only, sir. So, but
Reproductive medicine.
yes, sir. Yes, reproductive
Okay.
medicine. Maybe if I could say, if 60 is towards specialities, I think maybe more than 30 questions, maybe 5 or 10 questions extra, maybe 40 questions would have been asked from reproductive medicine, sir.
Okay. What is your
So
total score, ma'am?
it's 328, sir.
328 is one of the big score. By telling you find it easy is like you have given a best preparation. 328 is one of the best score. But I think because the exam itself, this year is a very tough exam. 333 is the highest score in urology and a specialty surgical side. I can after that neurosurgery and all 200 plus oncosurgery 310 something like that is a top score. So it is not a low score. You have done a wonderful job. But as you said, there are a lot of basic questions in reproductive medicine, which as a resident or aspirant has to be very strong, like semen values in the semen, the latest values, and the latest whatever the latest content in your standard book also be given importance, because if 5 to 10 questions comes from that, that will create a lot of impact rather than finding it a big book rather and unable to remember those content. And definitely the viewers will be benefited out of this. Definitely I want to convey people who are in Tamil Nadu. I really want to say there are a lot of competitions, and there are the number of seats have been tremendously increased when compared to any other states in India. So people who want to practice relaxed OBG practice as a as an infertility or a gynec oncosurgeon have to think about this 3 years of MCH. And this will be the definitely going to be the future Gynaec Oncosurgery, and you will get acquiring the skills will be definitely one of the wonderful way to practice the future. And as a final word, do you want anything to share to the listeners so that they will be benefited out of you, man?
Yes, sir. Uh, so subspecialization for OBG is coming up in a big way, sir. So our postgraduates start preparing even from the first year of their postgraduate days. So what I would say is that's the base. So do sincerely your 3 years of post graduation, make your basics very very strong, upon which you can start building up once you finish your post graduation, and that will go a long way in NEETSS, sir.
Thank you. Thanks for your valuable time, Dr. Kanmani, and convey my wishes to your family and your friend circle. We are very happy. The small part we able to design a content for the students has given a big impact in your examination is a real happiness. This has been available for last 2 years. The first time the people have as a person you have utilized the question bank, because as you said the module is a design given by me, and it was wonderfully done by our concept team of faculties. And we will try to create a content as a class, something like that, if time permits. But I am really surprised and happy that our vision of building a content able to help you people. All the best, doctor, and enjoy the rank one is not every time anybody can get, and rank one all day is one of the greatest achievement in your life. And feel good, you will rock in all your residency period and post residencies of course will be tough, and toughness and the plus and minus will be there. And post residency practice with a tremendous knowledge, learn always also marketing skills, because now most of the surgeons or doctors want the marketing skill. It is not marketing to an open forum. We know how to express ourselves to the patient. It is like how to convince our patient. That all is very important for everyone to practice. That also I share, because as a topper in academic, we should be top in convincing our patient. Otherwise we will be a worker for the corporate. So I don't want because we all are individual talented, and the medical profession is being projected in such a way as a profession we no need to depend our bends to someone as a slave, as in some profession which happens. So for that our convincing ability should be good. We all should learn, including I'm also learning day to day. convincing ability to my patients. So with all that, we will definitely do wonder in our practice, because what we dedicate ourselves is a huge amount of time for our enlightenment of knowledge. That should go only to us. Okay, so future is team practice. Think about that. I will over the period of time, I will release video how to go with the team practice. Wonderful time, Dr. Kanmani. Thanks a lot for your wonderful sharing to the audience.
Thank you so much, sir. Thank you so much, sir. You have played a part in my success.
Thanks a lot, madam. Thank you very much.